Good evening. This is Anil Irfan, founder and CEO of IMST Telehealth Consulting and the new founder of the Telehealth Champions Network. Good evening. Today's video, I want to talk about a recent blog that I just wrote for my on-call doc. And what we talked about is a very important topic. It's 3 alternative revenue models with telemedicine. Now, one of the things that always is discussed in regards to telemedicine is how do we get paid for it? With still a good amount of reimbursement barriers around the country, it's important to bring to light some alternative revenue models that can be deployed utilizing a telemedicine program. So I'm going to talk a little bit about those, and I will post the link to my blog post for my on-call doc. So really short. So one of the things I want to stress is telemedicine is an innovative way to deliver healthcare. So what's important to understand is we have to find innovative ways to get paid for it. And what I want to also stress is the importance of utilizing these type of alternative revenue models with telemedicine and creating those relationships for long-term success. So thinking out of the box of how to get paid for your telemedicine services. So, because listen, it is an innovative way to deliver healthcare, and I want to show some innovative ways to get paid for it. All right, so gotta have that concept in your mind. So first off, the concept of government-funded fee-for-service payments, traditional reimbursement, is becoming increasingly outdated and less than ideal payment model for 21st century healthcare, honestly. So the most successful telemedicine providers and companies are the ones that understand the current healthcare payment landscape and start shifting their thinking from reimbursement to revenue. So let me briefly go into the 3 different alternative revenue models that can be deployed with telemedicine. So number 1, institution to institution. A academic medical center or a small physician group can leverage their expertise and contract their specialty services to a small rural hospital or other institutions with specialist coverage need, right? So, these contracts can be structured per consultation, and they can provide either peer-to-peer support or direct care. And what's important to understand is that's not a reimbursement. Number 2, employee workforce offerings. This is very important and sometimes missed. But in the next 3 to 5 years, almost 70 to 80% of employees, especially self-insured employers, will be offering some type of telemedicine benefit. It just makes sense. All the self-insured employers that take on the cost of their employees visiting urgent care or visiting a doctor or paying co-pays, they accrue that cost at the end of the year. So providing a telemedicine benefit can cut costs extremely on healthcare coverage for their employees, but also affect their bottom line. Cost savings affect bottom line. So a primary care provider or a group of primary care physicians, what they can do is they can contract their services on a per consultation or a per member type of arrangement with the employer to provide that telemedicine benefit. You can show real ROI to an employer by providing a telemedicine benefit to their employees. So that's number 2 revenue model that can be deployed. Number 3, also a lot of movement here, international arrangements. These new technology has created an explosion in demand for international telemedicine specialty, especially in fields like radiology and pathology. And it's a growing business as well. Academic medical centers and physicians participating in it Not only can physicians treat patients in remote or underserved areas, but they can also tap into international patients who want access to specialty care in the U.S. and maybe not be able to travel. And there's a big need for United States expertise overseas. And once again, these type of programs, they're not reimbursement, they're contracts. And what I say is, if you establish these relationships and establish these contracts and service them well, they are revenue streams that you can create forever for you, for your medical institution, physician group, whatever it may be. It's just thinking out of the box about how to establish these revenue models. So, once again, thank you for your time today. My name is Anil Irfan. I am the founder and CEO of IMST Telehealth Consulting, also the founder of the Telehealth Champions Educational Network. I'm reviewing a blog from the My On Call doc. We'll share the link for it. But I just wanted to share 3 alternative revenue streams that you can deploy with your telemedicine program. Thank you very much for watching. Check back for updates. Visit IMST Telehealth for more information. Visit My On Call doc to learn about one of the most proactive, innovative telemedicine platforms out there, and we'd love to field any questions you may have. And remember this, telemedicine is an innovative way to deliver health care. Let's start thinking out of the box and find innovative ways to get paid for it. Focus away from reimbursement, think about revenue and positive outcomes. Thanks for your time, guys.